Good evening, guys. And today our topic is to measure the GFR by an exogenous substance known as inulin. As you know that glomerular filtration rate is of great importance to determine the function of the kidney and to determine how the kidney is functioning. Is it functioning properly? The normal amount of GFR is 120 ml per minute by the both kidneys. Okay, but how we get this value? How we gonna estimate that a person's kidney is functioning good or no? So the substance used for this purpose is called as inulin, and inulin has some of the major properties so that we can use it freely and certainly. Properties are like it's non-toxic for the body. For example, if we put administered intravenously inulin, it is non-toxic to the body cells. It's exogenous, it is not endogenous, it is not produced by the body cells, and it has no plasma protein binding. The substances that are bound to the plasma proteins are not freely filtered. For example, if calcium or the drugs are bound to the plasma proteins, they are not freely filtered along the glomerulus. Okay, and inulin has no charge. It's not positive and it's not negative. It is inert molecule, so that it is not repelled by the glomerular basement membrane, because the glomerular basement membrane carries a negative charge. Inulin is a very small molecule, so that it is easily filtered across the filtration barrier and it is freely filterable. And in the renal tubules, the most important properties for the inulin is that it is neither reabsorbed and it is nor secreted actively or passively. And regarding these properties of inulin, we can say that the amount of inulin filtered here is equal to the amount of inulin present in the urine. It means that the filtered load of inulin is equal to the urinary load or excretory load of the inulin. It's logical that it's not being reabsorbed and it's not being secreted, so amount present in the filtrate passes through the tubules unabsorbed and not secreted, so amount of inulin present here is equal to the amount of inulin present in the urine. So we can write in an equation form that filtered load of inulin is equal to the urinary load of inulin. Let's talk about the filtered load. The filtered load of inulin depends on two factors or two conditions. First is the plasma concentration of inulin, how much inulin is present in our blood. For example, if 1 ml of plasma or 1 ml of blood has 1 mg of inulin, so we can say that the plasma concentration of inulin is 1 mg per ml. Okay, it's logical. The second factor on which the filtered load depends is the volume of the plasma filtered per minute. Volume of plasma filtered per minute, what we called it? We called it GFR. Okay, we call it as GFR. So the amount of plasma that is filtered along the filtration barrier in 1 minute is also called as the glomerular filtration rate. Okay, so it means that if 10 ml of plasma is filtered per minute, so filtered load is 10 mg. If 100 ml of plasma is filtered, so filtered load will be 100 mg. And in physiological circumstances, if 120 ml of plasma is filtered in 1 minute, so the filtered load of inulin will be 120 mg per minute. It is equal to the GFR. We are considering this side of the equation, right? So filtered load means plasma concentration of inulin multiplied by GFR. GFR is nothing but the volume of plasma filtered by the kidneys in 1 minute. So what about the urinary load? We also have to calculate the urinary load as to equalize the equation. The urinary load depends on the urine concentration of inulin. Okay, it is in mg per ml. For example, if 1 mg of the inulin is present in 1 ml of the urine, so we call it as the urine concentration of inulin. And second is the urine flow rate. Urine flow rate, that amount of the urine that is produced in 1 minute, so it's ml per minute. So urinary load is urine concentration of inulin multiplied by the urine flow rate. As we have balanced the two equations, so we can say that filtered load is equal to urinary load, right? So filtered load is equal to urinary load. We can put the values of the filtered load here and the urinary load here. So filtered load was plasma concentration of inulin multiplied by GFR, and urinary load was urine concentration of inulin multiplied by the urine flow rate. So by this equation we can calculate the GFR. This plasma concentration will go on the opposite side in the division form. So we get this equation, and it's very important for calculating the GFR for a person. It means that the GFR is directly proportional to the urine concentration of inulin and the urine flow rate, but it's inversely proportional to the plasma concentration of inulin. You don't need to memorize this equation. You can just logically make your own equation. It's very simple. Just put the filtered load values and put the urinary load values, and you are good to go. Let's talk about the first example. The example number one is that, for example, plasma concentration is 1 mg per ml and urine concentration is 120 mg per ml and urine flow rate is 1 ml per minute. Putting all these in this equation, urine concentration 120, urine flow rate 1, and plasma concentration 1, and we get 120 ml per minute. This is the physiological value for GFR. But in the second patient, we have increased the exogenous administration of the inulin. We have increased the plasma concentration of inulin from 1 to 2. In this case, we have 2 mg of inulin per ml of the plasma. So but urine concentration is same. Okay, urine concentration in the patient number 1 and patient number 2 is same. So how we gonna get GFR? Think logically that if the amount of inulin present in the urine is same in both patients, but the second patient has 2 mg of 2 mg of inulin per ml, and the first patient had 1 mg of inulin per ml, so we need less amount of GFR. It means that the smaller volume of the plasma is required to produce the same urinary load. It means that from the filtration barrier, okay, in the first person, in the first person, in the first person, there was the GFR of 120 ml per minute, right? But in the second patient, we need GFR of 60 ml per minute. Why is that so? Because we have 2 mg of inulin in the blood, but the amount of inulin present in the urine is 120. So 60 multiplied by 2 is 120. Okay, we need the amount of GFR to be reduced as to equalize the inulin concentration in the urine. For example, if we take the third example, the plasma concentration is 10, okay, it's 10. Urine concentration is 600 mg per ml and urine flow rate is 1, so it's 60 ml per minute. We need 60 ml per minute of GFR to produce 600 mg of inulin per ml of the urine. So you just need to put the values in this equation, and it will be clear to you. Second important thing is creatinine. What is creatinine? Creatinine is an endogenous metabolic waste product, and it has similar properties as compared to the inulin, and it is freely filtered. It's not reabsorbed, and it's slightly secreted. It's slightly secreted, it means that the GFR would be slightly high, but we can make an adjustment. The advantage for the creatinine is that we do not need to make an external IV for the administration of creatinine. It's just endogenously produced in our body. So ideal GFR marker is inulin. It's gold standard, but common clinical GFR marker measurement is by the creatinine. I hope you guys are clear that inulin is a substance that is freely filtered, it is non toxic, it is neither secreted nor reabsorbed by our renal tubules, and the amount of inulin present in the urine, the plasma concentration of inulin, and the urine flow rate. These three factors can be used to determine the GFR. GFR is the amount of plasma that is filtered per minute. I hope you are clear, and I will see you in the next video. And our the topic for the next video is the autoregulation of the kidney. See you then.